Thank you all for your attention. So my project is entitled Expanding Substance Use Disorder Education for Duke Medical Students. And I'm going to start on the next slide by introducing three problems that I'm pretty sure everyone in this audience is already aware of. Problem number one, substance use is a public health crisis. Most of you will already be aware of the chilling statistics around the morbidity and mortality related to substance use and overdose in the United States. Substance use is a major contributor of preventable death. As you see on this graph, over the last 20 years, the rates of overdose deaths have just continued to increase in the United States. And although this data doesn't include the pandemic years, we know from recent studies that overdose and substance use and mental health diagnoses continued to increase during the pandemic. For a few numbers, cigarette smoking accounts for 480,000 deaths per year. Alcohol poisoning, injury, violence, and related diseases from alcohol caused nearly 100,000 deaths per year. And in 2018, as you see on this graph, almost 70,000 people died from drug overdoses, and nearly 70% of those involved in opioid. So the second problem to introduce you to, there's a large unmet need for substance use disorder treatment. Can we go to the next slide, please? Over recent years, this has remained largely unchanged. The percentage of the US population suffering from a substance use disorder has remained stable around 7.5% over recent years. And similarly, the low percentage of people with a substance use disorder who are able to access treatment has also remained low and similarly stable, and we've made minimal progress. In this graph, you can see that in 2019, only about 12.2% of patients with a substance use disorder received any substance use disorder treatment, and that has been unchanged over the past 5 years or so. And so on the next slide, the third problem, medical training provides inadequate exposure to addiction medicine and also provides a hidden curriculum that actually discourages future addiction training. We all know that providing formal education for health professional students in substance use disorder diagnosis and treatment is an important component of the public health response and in providing increased access to treatment for patients with SUDs. And while the footprint of addiction medicine has globally increased in medical schools over the past decade, there's still insufficient and inconsistent education on these topics throughout medical schools. And as this sort of fake headline from the Gomer blog points out, medical schools actually may discourage students from engaging in future treatment. Students may enter their training optimistic, bright-eyed, and bushy-tailed and idealistic, and then they become discouraged by the systems that they train in. And they absorb a hidden curriculum about SUD patients and their treatments. For example, take a medical student rotating through the emergency room. They may hear casual remarks by staff about intoxicated patients, quote, just coming in for a turkey sandwich and a bed, or they may hear an emergency provider who is skeptical about the resources that are going to be available to that patient, or the likelihood that a particular frequent flyer in the emergency room is actually going to follow through outside of the ED. Or they may hear psychiatry staff dismissing a patient's suicidal remarks because they're intoxicated and, quote, just drunkicidal. And so all of these problems raise issues with providing access to address this public health crisis. So let's go to the next slide. So my question was, what about the Duke School of Medicine? What are we doing to address this? Well, among the 5 medical schools in North Carolina, all 4 offer the 8-hour buprenorphine waiver training, or the X-waiver training, as it's also known, as standard coursework for its medical students, except for Duke. And Duke doesn't provide any time in its curriculum for this, even though the training is available for free online to medical students. So let's go to the next slide. My first step in this project was to gauge the Duke medical student interest. In their final year of training, the Duke medical students participate in a course called Capstone, which is their residency boot camp in the spring. And out of the 112 graduating medical students who enrolled in Capstone in 2021, 80 of those, or 71%, actually freely chose to attend additional SUD training in the form of an elective lecture that I gave on the management of substance use disorders. And so this indicated that there actually is a pretty strong interest in additional SUD training among these graduating students. 61 of those 80 students, or 76% response rate, completed a survey at the end of the training regarding their attitudes toward buprenorphine. So So on the next slide, I have the results of these surveys. Of the respondents, a whopping 93% felt that the waiver training should be offered as part of the standard medical school curriculum, and stated things like, you could make an argument for putting the training anywhere in the curriculum, but it should be offered somewhere. And then when they were asked how likely they are to complete the 8-hour training on their own, just over half, 55% of students reported that they were likely or very likely to complete the training on their own during their own free time. But less than half, or 44%, responded neutrally or felt they were unlikely to complete it. And reasons given were that it was hard to find the time or motivation outside of their required responsibilities, or that they would do it if it counted for credit or if it were required, but that they were unlikely to do it in their own time. So taking all of this data into account, on the next slide, my objective of this project was to develop this additional didactic experience for Duke Medical students during their clinical years that would allow them to explore the historical and cultural contexts of substance use, reflect on their own experiences and biases that they had developed toward patients with substance use disorders, and to complete the buprenorphine waiver training with credit given for it. And this coursework would add to existing lectures that cover the pharmacology, diagnosis, and treatment of substance use disorders in the preclinical curriculum, which is already offered to all of the students, and the initial experiences that they have on their clinical rotations in psychiatry, medicine, OB, et cetera. But this course would go beyond the diagnosis and treatment to encourage them to engage in some self-reflection and to explicitly address that hidden curriculum and biases that they experience during their clerkships. The hope is that students will feel more comfortable treating and advocating for this population in their future, and that even students who will never write a prescription for buprenorphine may be more likely to identify patients in need of treatment, to provide empathic interventions, and to refer patients for those treatments. So on the next slide, there's a flow chart which will walk through the process of the course development. There's a lot of words on this slide. Also talk about some of the strategies used to gain the buy-in that was needed from education stakeholders to find the time in their curriculum. So the first step, I met with psychiatry departmental leaders, and then met also with other School of Medicine course directors to survey what was already offered in SUD topics in other courses to avoid redundancy. At this point, I also spoke to education leaders in other state programs about the education that they're offering in substance use disorders and how best to integrate it at Duke. The capstone lecture I spoke about earlier was introduced, and that data was presented to the curriculum committee. For my own professional development, I attended a conference and arranged to expand my own clinical role in substance use treatment by starting to round on the inpatient opioid consult service. And after all of this, the new curriculum was developed and feedback was solicited. So on the next slide, the course outline that was developed is shown. Students will meet weekly for 2 hours in the evening for 8 weeks, and some highlights of the course include exploration of the war on drugs and looking at biases that our culture holds, as well as personal biases that students may hold, and finally discussing some current issues like vaping, pain management, and how to discuss cannabis use with your patients, for example. Course participants will also complete their buprenorphine waiver training and will engage in self-reflection and some advocacy activities. So the outcome of all of this, the course was presented to the School of Medicine Curriculum Committee in August of 2021, and approval was granted for the first session of this elective to be offered in January of 2022. The next steps for me include recruiting guest lecturers and panelists for the course, continuing to develop and refine the course content, and formalizing a clinical shadow experience for the students on one of the substance use services at Duke. A survey is going to be distributed to participants before and after the course to assess their attitudes and knowledge about substance use treatment, and I will continue to work with other course directors to coordinate and expand SUD curriculum throughout the medical school as the years go on. So on this last slide, I'm going to discuss some lessons learned. Although students are interested in SUD education, merely offering elective experiences and self-directed learning is not going to provide a consistent educational experience for all of the students. However, there are a lot of competing demands for time in the curriculum, and some creative strategies like introducing an elective are needed to first introduce SUD education to the School of Medicine. Through this project, I found that I was able to meet with a network of educators within the medical school as well as outside and to form some collaborations that will enable future curriculum development. And I hope formally integrating this into the required curriculum at Duke. And that is the end. I will take any questions. Thank you.